Welcome to part 4 of Dr. Loria's Girth consultation video. In this final part of the series, Dr. Loria will answer frequently asked questions, such as when to resume workouts and intercourse, followed by his closing comments.
So let's go over some common questions. Patients always ask me, when can I resume intercourse? Because if I have a procedure done, I have these bandages on, well, how long is this going to take? Usually 21 to 28 days. Okay, if you're healing rapidly, 21 days. If you need a little more time, you wait till 28. Okay, now does this procedure affect sensitivity? Okay, now let me tell you that the nerves that exist right now in the penile shaft and glands do not go anywhere. After I do the treatment, the nerves are still there. What's going to happen though is as you get larger and you get ultimately to your 6 3/4 size, let's say, the same nerves are here. So when you have intercourse, you'll feel more. So it'll appear as though you're more sensitive, but that's really not the case. The case is that these nerves never felt such pressure. Okay, so it might appear you're more sensitive. Okay, but in actuality, you're just feeling more pressure and so forth. Okay. Now, does this procedure affect you in any negative way regarding having an erection? Absolutely not. Does it affect your ejaculatory function? Absolutely not. Does it affect urination, fertility, or testicular function? No. And I'll tell you why. And I'll try to explain this with a diagram so you could see some of the anatomy, okay? We have the inside of the penis. If it looks like this, basically, you have two of your main chambers that fill with blood, okay? Two chambers. And you have this part here is where the urethra is, where you urinate. This is the deep portion of the penis that we don't even go near, okay? Now, there's a reason for that. If you look at this cross-section, okay, you'll see that the innards of the penis are here that fill with blood and cause the erection. We work on the outside only, okay? And you'll see some very thick fibrous layers here. There's very thick fibrous layers, like a straitjacket in a sense, that actually covers those blood-filled tubes. They're like concrete walls. So when I enter in superficially, and I go along this way underneath the skin, you have 3 concrete walls to go through to get to the inside of the penis where those important anatomical structures are, which we're not even near. Okay, so you have that straitjacket of fascia, if you will, or like 3 concrete walls to get through, and we're not going to be able to get through it with a blunt instrument. See, so there's safety built into this procedure. Okay, so in other words, don't worry, it doesn't affect those functions, and that is why. Okay, now, what about complications? Okay, let's talk about that. Someone says, what complications could occur? I'll tell you that most of them, if we were to have a problem, it has to do with this constrictive element here, because it can cause skin sores. Okay, the skin doesn't like constant pressure, so we have to monitor that carefully. It's very rare and uncommon to have a sore develop here or here. Okay, that's not common. It does happen more as we get to sizes like this. When we get really large, let's just stay with this size actually, 6 3/4. If we were to continuously proceed with other procedures, there seems to be a higher risk when you're going over to 7 and 8 inches in girth that you might get some skin sore development, but they heal. It takes time. If you develop a skin sore, it might take another 4 weeks or 6 weeks to heal, but they do heal, okay? Now, let's move on. We spoke about how to take a shower. If you still have the bandage on, you put a condom. We mentioned that already. How about working out? I do not want you to work out at the gym for a week. There's a reason. After you leave the office and after, your bandage and so forth, you're going to swell a little bit. That's normal. You're going to have some bruising. That's normal. Even some minor blistering. That's normal. But if you work out, you increase the blood pressure, and the pressure will cause more swelling. I don't want that. So for this first week, no working out at the gym. The second week, you could go light, like 50%. And after 14 days, you can do a full routine, okay? So that's in regarding working out. Let's talk about some work restrictions, occupational issues. If you're a heavy laborer, like a furniture mover or a tile layer, okay? If you're bending down, that's what I'm really getting at. If you bend down, the pelvis rotates, okay, as you're bending, and it pulls the penis inward. Now imagine this. Here you are, bandage like this, okay? And let's say the next day you're gonna lay some tile flooring. If the pelvis is pulling in this way, it might disrupt the bandage and pull the penis into the bandage, and we don't want that, okay? Now, if you need to bend down, normally, let's say you have a child and you want to pick up the child, you just bend down on one knee. That prevents full rotation of the pelvis. That's fine. If you're sitting at a desk, you just slouch a little bit and you're fine. Okay, you could work all day, not a problem. If you're standing, no problem. It's the squatting motion or even abdominal crunches, that type of motion will cause the penis to pull inward because your penis is attached to the pelvis. Okay, it's attached to the pelvis. Your penis doesn't fall off, right? It has to be attached to something. So when you squat, the pelvis rotates and pulls the penis in, and the bandage may become disrupted. In a case like that, if you have that occupation, I'd recommend 10 days. Okay, 10 days off, if that's possible. So that's that situation. Okay, now, how about, let's talk about having multiple procedures. Let's say you had a treatment, and you know your goal. Let's assume this is your goal. Okay, you're normally like this, and this is your goal. Okay, you may need 2 or 3 treatments. So let's say you did a treatment today, you'll look like this. 4 weeks later, you can do your second treatment. 4 weeks later, you could do your third treatment. Okay, so 4 weeks in between, about a month. Okay, that's that. You need a month rest in between, or anytime after. It doesn't have to be a month later. It could be a month later. It could be 5 months later. It could be a year later. Okay, so that you work at your own pace. Okay, now that is basically what we're going to cover in this consultation. Now, of course, I do have live consultations by phone. Okay, usually 2 times a week. So you might want to join us to listen, because then you could ask questions that you may have. So I'll talk, let's say at 7 o'clock, we'll start a consultation, a live consultation. And after I give you these basic facts that I'm giving you now, then afterward you could ask questions, okay, that I'm not covering, because there's a whole host of questions you could ask, okay, a whole host of questions that we don't have time to go through now. This is just an initial cursory consultation and so forth. So I'd recommend that you consider listening to a live consultation with me. And all you do is call my office, and they'll help you and show you how to join and so forth. Also, look at the website. The website has a wealth of information. We'll be updating it periodically, but we have a lot of before and after pictures that I want you to look at. There's some information under the Our Procedures section. Okay, that's probably the most important section, and it'll go through many topics that may interest you. Okay, so anyway, this is the conclusion of this video consultation. I hope it was helpful. And again, keep in touch with us, and if you have any questions, you can email. You can email me directly at info@loriamedical.com.